वेलकम टू स्पेशल एजुकेशन विद हामिद नकवी। MCQs का सिलसिला हम जारी रख रहे हैं और आज फिर हम विजुअल इम्पेयर्ड चिल्ड्रन के हवाले से MCQs की प्रैक्टिस करेंगे। तो आइए शुरू करते हैं। फर्स्ट क्वेश्चन, द विजुअल एक्विटी ऑफ लो विजन as per WHO 1992 definition is less than 6 by 18 to 3 by 60, 6 by 18 to LP, 6 by 18 to 360 and less than 360. The correct answer is as per WHO definition, the correct answer is less than 618 to 360. Next question is visual field of low vision as per WHO 1992 definition is 90 degree, less than 30 degree, 20 degrees or less, 10 degrees or less, and the correct answer is delta D, that is 10 degree or less. Next question is 6 by 6 visual acuity is normal vision, low vision, partially sighted or blind, and the correct answer is A, that is normal vision. 6 by 6 is normal vision. Then low vision is blindness, absence of light perception, not blindness but absence of useful vision, and refractive error. The correct answer is C, that is not blindness but absence of useful vision. Visual accommodation involves a change in which structure? Lens, cornea, retina, or foia? The correct answer is A, that is lens. Next question is, if project A overlaps object B, we perceive object A as being closer. Which depth Q are we using? Relative size, linear perspective, proximity, interposition, and the correct answer is D, that is interposition. Dash is the ability to sense the position and movement of our body parts. Proprioception, 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 proprioprediction, and the correct answer is B. Then a researcher interested in the relationship between physical stimuli and our psychological experience would be studying A, extrasensory perception, B, proprioception, C, auditory realism, and D, psychophysics. Correct answer is D, that is psychophysics. When a person enters a dark room, their pupils dash to allow more light to enter their eyes. Constrict, curve, dilate, A or C? Correct answer is C, that is dilate. Then next question is, the optic nerve carries information to the retina, then the cortex, the retina, then the thalamus, then the cortex, or the cornea, then the retina. The correct answer is C, that is thalamus, then cortex. Next question is, in-depth perception accommodation would be most useful for which activity? Playing golf, threading a needle, driving a car, flying a kite. Correct answer is B, that is threading a needle. Then next question is, when detecting color, hue depends on wave dash while brightness depends on dash. Height length, length height, intensity consistency, consistency intensity. The correct answer is B, that is length and height. Next question is, what is the stimulus for vision? Electromagnetic energy, electrovisual energy, electrostatic energy, electroconvulsive energy. The correct one is A, that is electromagnetic energy. Next question is, which of the following is not a set of opponent colors according to the opponent process theory? Red blue, red green, yellow blue, white black. And the correct answer is the first one, that is red blue. Then the question is, visual accommodation involves a change in which structure? Lens, cornea, retina, foia. The answer is alpha. Then when a person enters a dark room, their pupils to allow more light to enter their eyes. Constrict, curve, dilate, A or C? It is C. The optic nerve carries information to the retina, then the cortex, the retina, then the thalamus, then the cortex, the cornea, then the retina. The correct answer is C. When detecting color, hue depends on wave while brightness depends on height length, length height, intensity, consistency, intensity. That B is the correct answer. That is length and height. What is the stimulus for vision? Electromagnetic energy, visual energy, electrostatic energy, electroconvulsive energy. Correct one is A. Then which of the following is not a set of opponent colors according to the opponent process theory? Red blue, red green, yellow blue, white black. Person with low vision means legal blind with residual vision, refractive error, impairment of visual functioning even after treatment, or standard refractive correction, and functional vision loss. Correct answer is C. Then some people cannot see distant objects clearly without spectacles. This defect is called accommodation, stress, farsightedness, or nearsightedness. The correct answer is D. That is nearsightedness. The inability of the eye to see the image of the object is called defect of vision, near point, far point, accommodation. The answer is A. Then the disability of the eye to form distinct images of nearby object on its retina is known as nearsightedness, farsightedness, stress, or accommodation. Correct answer is C, that is stress. Now some of the important terms which we use in visual impairment, and the short answers are in front of them. They can come in different forms of objective questions. Legal blindness, the definition of legal blindness is vision of 20 by 200 or worse in the best eye, with the best possible correction or field of vision limited to no more than 20 degrees. This is correct definition of legal blindness. Then profound visual impairment is called blindness. Low vision is vision of 20 by 70 to 20 by 200. It is also called partial sightedness. Then do visually impaired children can damage their eyes by using them too much? The answer is no. Then moderate to severe vision loss is related to low vision. Visual impairment is classified on educational basis and legal basis. Most visual impairment of school-age children are congenital. Many students who are blind have additional disabilities. Mobility techniques are sighted guide, walking alone, cane techniques. Conditions almost always associated with photophobia is albinism. Albinism is also called acromia. Partial or total defense of pigment in eyes, hairs and skins is also called albinism. Then substance in body that gives color to skin, hair and eyes is melanin. Opaque or cloudy lens due to trauma or age related to cataracts. Then cataracts results from the damage to the lens. Loss of lens transparency is cataract. Dim light should be used if cataract is located in the center of the lens. Brighter light should be used if cataract is located in peripheral part of lens. Lens block light from reaching retinal receptors in cataract. Cataract is the condition in which spot is appeared in pupil of eyes. Ocular spot problems result in glaucoma. Blocked aqueous humor is related to glaucoma. Eye pressure caused by fluid blockage is glaucoma. Untreated glaucoma results in blindness. Sneak thief of sight is called glaucoma. Excessive pressure built up in aqueous humor caused glaucoma. Closed angle glaucoma is called acute glaucoma. Open angle glaucoma is called chronic glaucoma. Increased pressure of fluid due to glaucoma damages is optic nerve. Glaucoma mild in nature is open angle glaucoma. Glaucoma severe in nature, closed angle glaucoma. Fluid is drained slowly, partially at trabecular meshwork, that is open angle glaucoma. Glaucoma causes the loss of peripheral vision and fluid is not allowed to flow, drain in glaucoma. Macular degeneration. MD stands for macular degeneration. Area of best central vision is macula. Yellow area in the center of retina is macula. Macula means spot. Macular degeneration affects central vision. Small areas of retina contain special cells sensitive to light, macula. Yellowish deposits in macula called dry MD. 85 to 90% cases of MD are related to wet MD. 10 to 15% causes of MD are related to blood vessels. Wet MD results from the growth of abnormal retina, and leakages of blood of fluid in retina causes wet MD. Leakage of blood fluid in retina causes wet MD. Then abnormal blood vessels leak the fluid or blood in vision loss. Severe form of MD is ocular motility disorder. Then absence of the lens of the eyes is anophthalmia. That's all. See you in the next video. Till then, stay blessed.